Hello, and welcome to the Chronic Diabetic Care demonstration. My name is Brandon Dupuis, and I'm an integration architect with Cerner Corporation. Today we're going to highlight our patient, Fatima Lee, who's a 33-year-old Asian female, as she manages her type 2 chronic diabetes. Fortunately, interoperable data standards enable access to Fatima's past care information as she seeks care for her latest encounter. We will follow Fatima as she arrives in the ED and is discharged to follow up with her care manager, where she receives necessary home medical equipment, access to individualized home health services, and the ability to access her immunization and COVID-19 vaccine status. Fatima is a college professor who recently relocated to Oxford, Mississippi for the new school year, and unfortunately, she's struggling on a couple of fronts as she adjusts to life away from her extended family. She was recently in a motor vehicle accident and is wheelchair bound due to a right femur fracture, and her surgical incision site looks red and is hot to the touch. Additionally, Fatima has a history of repeat ED visits specific to managing her chronic disease, and today Fatima arrives in the ED via ambulance confused and stating that she has a headache, elevated heart rate, and high glucose readings. Fatima stated that she has not felt well for several days due to fever, nausea, and vomiting. So now we'll transition to the Cerner power chart. We can see that Fatima's record is pulled up here, and something that was captured upon intake are members of Fatima's care team. In this particular case, we note that her primary care physician is Dr. Nil. She has a care manager named Janet Gibson, and we can also capture non-care providers such as her mother. Dr. Callahan, who's seeing Fatima, has ordered some lab results, lab tests along with a flu and COVID-19 test. While those are all happening in the background, I want to highlight the Cerner care notification that occurs in the background upon her admission. Since we have Fatima's PCP available in our system, this system, Cerner Direct along with Cerner Hub, will look up that NPI, identify the direct address of that physician, and send them a direct message indicating Fatima's recent encounter. Here you can see where she was admitted, their hospital service, the admit reasons, and other pertinent information relative to this encounter. Attached as well is also the HL7 and the XML CCD that contains a little more information around Fatima's recent admission. Jumping back into PowerChart, early in the workflow, Dr. Callahan's going to do a few things to review her medical record. She's going to go to our outside records page and search the national networks such as Commonwealth Care Quality for information that may not be in our system. There's also a summary view available to show a more aggregated view of that external data. Another thing that Dr. Callahan's going to do is reach out to the immunization registry to review known immunizations. In this case, since we're in Mississippi, that's the MIX immunization registry. We see here that Fatima is overdue for a COVID-19 vaccine, as well as in range for an influenza shot, and those can be ordered and administered during this episode of care. The test results have come back, and we see elevated results in both glucose and A1C. Moving forward in her episode of care, the diagnoses applied to this encounter have to do with her type 2 diabetes, as well as infection and inflammation on that hip, that femur incision. Upon finding this, discharge orders are placed. There's a few orders for medications for both pain and diabetes management, as well as consult orders to care management, home health, and the durable medical equipment order. Also upon discharge, Fatima is going to be given some discharge documentation outlining how to care for her diabetes, her glucose monitoring equipment, and her incision care. Also upon discharge, direct secure messages will be sent to both the consult for home health, the consult for case management, and for the order for the durable medical equipment. With that, I'll transition to Kim with Brighttree.
Hello, I am Kim Katz, Brightree's ePrescribe Program Manager. I will be representing the home medical equipment outpatient referral from Cerner's electronic health record to Brightree's referral management worklist solution. This is via direct secure messaging. As Cerner mentioned, we have an ambulatory patient shifting from the emergency department to home. Dr. Callahan sees that Fatima has uncontrolled diabetes from her labs and assessments. Dr. Callahan orders a home continuous glucose monitor device from his native work environment in Cerner's Power Chart. Here, the order is received in real time into Brightree's referral management work list. The HME is going to receive an alert notification that they have an order or a referral to fulfill. When the CCDA lands into Brighttree, it falls into the Brighttree referral management work list. Here, key data elements are collected. There is automation and reconciliation tools that parse all the key data elements over. Here, on the referral management work list, we are showing all the key data elements that are parsed over to fulfill this order. If you go on each tab, you will see where the key data elements were captured. Here you have the last name, first name, date of birth, medical record number, billing address, delivery address, the patient's mobile number, email address, ICD-10 codes, gender, height and weight, and the ordering provider. You can also see on the Insurance tab where the payer information came over, as well as the policy number and any other information. Behind the scenes, it will check eligibility. On the Sales Order tab is where the device and product is captured. Here, the continuous glucose monitor. On the History tab is an audit trail also showing what the system has done. Here, it's showing that the system associated with a patient already on file when the data was parsed over. Once the device is delivered, Fatima is ready to begin her home health admissions. The connectivity between the EHR and Brighttree provides the home medical equipment to dispense a product securely and offers better patient outcome, where Fatima can monitor her diabetes continuously, minimizing her wait time. This is reducing fax and telephone, capturing accurate data, replacing manual intake. Next on Fatima's journey is her care with Netsmart. Here is Amanda. Thank you.
Thank you, Kim. Hello, my name is Amanda Wayman. I'm Client Success Manager with Netsmart Technologies. I'm here today presenting on the care coordination piece of Fatima's journey. Janet Gibson is Fatima's care coordinator as assigned by her insurance plan. Janet's primary goals in working with Fatima is to prevent recurring ED visits. She does this by helping her manage her chronic diabetes in a few different ways. She can help coordinate transportation to preventative care appointments, regular communication through our bidirectional messaging, and monitoring that she's taking her medication as prescribed. Janet uses Care Manager, which is Netsmart's care coordination software, to do her day-to-day activities. When she logs into Care Manager for the day, she immediately sees any time-sensitive client-specific alerts received by integrated partners, any tasks that she may have to complete, and then she can move over to her inbox for her secure direct messages. Here she sees that Phyllis Callahan from Baseline West Medical Center sent her an alert that Fatima was seen recently in their emergency department. Janet has the option to download the CCD directly from her inbox, or she can open Fatima's chart and query the Care Quality Network. Care Quality is a nationwide framework that allows Janet to query this visit along with any others that may have occurred in the area. So when she gets to Fatima's chart, all she has to do is come down to Care Quality. And because we have it configured to search all of the partner organizations in the area, with a click of a button, she has all of those CCDs. She does find that the only recent visit is with Baseline West Medical Center, and she can choose to view the CCD here, make any notes she needs, and save to the chart. So from here, Janet sends Fatima a message to follow up with her recent ED visit and ask if she would like help coordinating a mental health appointment to discuss the social isolations that she is facing within the post-COVID world. Janet also assigns new educational material through the My Health Point portal. My Health Point is a consumer app that will allow the care coordinator to work directly with the client in a seamless manner. So because Fatima has the app downloaded on her phone, she receives push notifications in real time that there's new activity in her portal. When we move over to My Health Point, Fatima logs in for the day, and she can see that now she has overdue morning medication that she must complete, and that it's time for her daily measurements. So because she has the new Bluetooth connected glucose monitor, all Fatima has to do is open her My Health Point app on her phone and immediately receive those Bluetooth connected measurements. If for some reason Fatima does not complete a mandatory activity, or if her daily glucose measurements are out of range, Janet will immediately receive a notification and be able to take action on those results. Fatima knows that Janet sent her communication through the portal, so she can come in here, view that notification, and reply as needed. She can view upcoming appointments, the education that Janet has recently assigned with her surgical wound care, and her social isolation and post-COVID conditions, along with a few diabetes-based articles. Once Fatima is done with this, she is ready to move on for the day. So now we have Miss Susan from MatrixCare to cover the home health portion.
Hello, my name is Susan Young, and I'm a product specialist with the MatrixCare Home and Hospice team. So on this part of Fatima's journey, we have received the CCDA message, or the direct secure message from Cerner with her home health referral. So here in the MatrixCare software, I can click on my e-referral indicator and be able to see that I have a new referral for Fatima. When I click on the ID, this will open up Fatima's CCD, and I'm able to see the information that has transitioned from Cerner. I can see a table of contents which contains hyperlinks to all of the information that was parsed over from the CCD message, and then that information will flow over into Fatima's chart into the home health application. So for example, I can click on the demographics to see that Fatima's name, care location, phone number, and information such as that has come over into the system, as well as her diagnoses, allergies, and her medications. The nurse that is assigned to Fatima is then able to use this information sent via direct secure message to discuss and reconcile with Fatima in her home. Fatima also receives services for physical therapy and occupational therapy to help with her recovery from the car accident. The physical therapist and the occupational therapist also have access to this information from the MatrixCare home health chart. After 3 weeks of home health care, Fatima is managing her sugars better, her incision is healed, and she's been cleared and instructed on safe mobility. The case manager for home health discusses her plan with the physician and case care manager, and she is discharged from home health. The next step in Fatima's journey is her immunization record. I will now transition over to Sarah.
Thank you, Susan. Hello, my name is Sarah McKee. I'm the Group Product Manager with SCC Health. Here you can see Fatima's immunization information in the state registry. EHRs and HIEs are able to have direct connections via an electronic interface and are able to not only send, but as you saw in Cerner's demonstration, be able to receive real-time information for all of their patients using an exchange of HL7 messages. In addition to viewing Fatima's demographic information and immunization history, the SDC platform is able to provide immunization forecasting information to indicate when the next vaccine in a series is due, while also validating the immunization information were given within the correct time intervals. Should a patient need an adjusted forecasting schedule due to an existing condition that it could affect the vaccine schedule, the forecaster is able to accommodate and make the adjustments as needed. Fatima is able to continuously manage her immunization information through a consumer portal called MyIR. Here you can see Fatima is not only able to be connected to Mississippi's immunization registry, but she also has immunizations in the Louisiana registry as well. So she's able to be connected to both of the jurisdictions and be able to pull in her immunization information. This allows for Fatima to have a full consolidated record with all of her information, as well as be able to pull back a consolidated forecasting schedule. This information allows for Fatima to have full access over her immunization information, as well as be able to share this with anyone on her medical care team so that they always have the most up-to-date immunization information. As a team, we use interoperability to inform better care decisions, reduce readmissions, decrease total cost of patient care, increase provider satisfaction, and improve the patient experience, and ultimately allowing people to focus more on living their life and less on managing their care. Thank you so much for attending. Please don't forget to scan your badges and let us know if you have any questions.